Okay, this is super common and it's a good thing to know because it is very possible it can happen in your labor. It might only happen once, but if it does, you're probably gonna be freaked out for a minute and then it passes, all is well. So I want you to hear that, usually all is well, but it can be temporarily a little bit unsettling or a little bit scary. If the monitors are on during labor, you're getting this tracing, right? Contractions are this one, fetal heart rate's one at the top. And you can see normal, good looking fetal heart rate, accelerations, variability, and then this big decel. So that's what the question is about, where the heart rate is dropping far below its normal baseline. And this one's a prolonged decel, it is staying too low. If your nurse is seeing this, which they are constantly watching your strip when you're on the monitors, they are going to do a couple things and it is going to happen very fast. Okay, these are the 4 things. There is some debate on which one to do first. Often they're all happening at the same time. There's debate on if oxygen actually helps, but you are going to see these 4 things happen a lot still in hospitals when there is a heart rate drop. And typically they're all going to happen at once because more than one nurse, probably your nurse and a partner or a buddy, are going running into your room when they see the baby's heart rate drop like this. Often they're moving so quickly that they may not explain very well. They should, they often don't. And so you are going to feel really panicky going, what in the world is going on? So when the baby's heart rate drops, position change is a huge one. Often if you just flip and move, it can get the baby off the cord or get them off whatever maybe is causing compression and just help that heart rate come back to normal. If the Pitocin is running, it will get turned off. If it's not running, then just forget about that. That's not part of it. Increasing IV fluids, if you have an IV and they're just gonna open up your IV line so it can just flood in quickly, the fluids can. And then putting oxygen on, and the thought there is more oxygen to you means more oxygen to baby. Always a helpful thing. Back to this photo, last thing I would really want you to hear is that, like I said, it is normal for your baby to have some sort of decel at some point during birth. Maybe not a huge prolonged decel like the one you see here or longer, but in general, when babies have decels, they typically do come back to normal. We can labor through them, we can do interventions or the things to rectify the situation and get back to, quote unquote normal, and you go on to continue to have your vaginal birth.